Hi, this is John McMath with the Sciatic Pain Terminator, where we teach thousands of people how to figure out the source of their lower back and sciatic pain so they can go on and live a healthy and pain-free lifestyle. Today we're going to talk about the difference between nerve pain versus muscular pain. I think muscular pain, most of the people understand what that is. You know, you pull something, you strain something, you know, all the way from junior high athletics all the way up to the pros. You hear about that all the time, you know, injury reports, you know, you watch ESPN, you hear about this, strain this, pulled that, probable, could play, out, and typically, unless it's a really bad injury, they're, you know, back that week or in a couple weeks. Well, when you have nerve pain, like for example, take Peyton Manning, that's a potentially career-ending injury. And you know, Larry Bird, if you know anything about his wonderful career, you know, 1985, he herniated a disc, shoveling gravel, building a driveway for his parents and his farm in Indiana. Joe Montana had a herniated disc. Troy Aikman had a herniated disc. And they were just literally stopped in their tracks. And fortunately for Troy and Joe, they're able to have successful surgeries and go on, and Troy won 3 Super Bowls after it, and Joe had won 2 Super Bowls after his surgery. Of course, he'd won the 2 before he had suffered the back injury. So when you have nerve pain, you know, it's, if you think of it this way, your check engine light in your car, where something's on, that's your warning light to say, stop what you're doing. And you cannot play through this. You cannot tough it out. Randy White, for example, one of the toughest guys in all of football who ever played the game, he had a pinched nerve in his neck and his shoulder. That essentially ended his career. You can't play through this stuff, and it's very serious. So this is really one, if you're suffering through this, to not feel bad about yourself or be hard on yourself. It's like, man, I had this muscular pain when I was younger and I could play through it, and now I can't even lift a pencil. Well, yeah, because nerve pain is that much more sensitive than a muscular pain. And also, this is for your caregivers, because a lot of times your caregivers and it's no fault of their own, they just don't understand how debilitating this is. So, you know, hopefully this video will help, you know, make the difference of, you know, when you have, you know, muscle pain, you can get out of it in a week or 2 or maybe a month or a couple months, you know, ice, physical therapy, and you know, you'll be back in the saddle. Nerve pain, you know, it's a very delicate deal, and if not approached correctly, which we teach those principles in the Sciatic Pain Terminator, you know, if you're an athlete, in your career, you'll never be able to do what you were able to do again. But just to be able to do simple things, like in my case, I was bedridden for 9 months. I couldn't even walk. I had to use a diaper when Jennifer was gone. You know, all sorts of things like that. So really wanted to stress that there are huge distinctions in the two, and that, you know, you've got to get the proper diagnostic when you're talking about nerve pain. You know, muscular pain, usually an MRI will do the trick. You can see tears through that. MRI will only see that if you have, for example, in a disc herniation, you know, something inside the spinal canal. Nerves are invisible outside the spinal canal to an MRI. However, the MRN, which is what Dr. Filler invented, is able to see nerve impingements. So that will, you know, if you've been in this problem for a while, where you have been from doctor to doctor trying to figure this out, physical therapy, chiropractic, Eastern, Western, the whole gamut, I strongly suggest that you check into the MRN and it will see if you have a mechanical impingement, which I've worked with thousands of people, and in over 95%, and it's probably closer to 98 or 99%, the cause of their pain, not psychological, not systemic, it is caused by a mechanical impingement. That check engine light in their car is blaring, and it's telling, the pain is just a symptom. It's just telling you something. So what you got to do is get to the source. So if you've gone through all these things and you're not any better, I strongly suggest getting the MRN, checking into that, and you will find what the problem is. So wanted to throw that in there too, because we can talk about nerve pain and sciatic, or not sciatic, which is nerve pain, but muscle pain, and that's great, but okay, what the hell do you do about it? Well, this is what you do about it if you are in this predicament that I was in, where I went all over the United States and into a foreign country to try and figure out what in 15 minutes Dr. Filler figured out with the MRN. So I hope this really helps you on many levels. One, to tell you there is a distinction in the two, to not be hard on yourself if you are, I used to be able to tough this out and now I can't. And also for your caregivers, to help them, I don't want to say sympathy, because I think caregivers they all mean well, but when you've never had this, you can sit here all day and explain how bad it hurts, and until you have it, and believe me, I don't wish, and I don't think if you're suffering and watching this now, you don't want anybody to have this. Unless you've had it, it's really, you just don't really get it as much. Well, hopefully this will really bridge that gap. And maybe not 100% where, okay, I've had it, I get it, but at least get it to where, okay, wow, this is huge, this really hurts, I can understand why, you can't even do just the mundane task. And then also what to do if you've reached this dead end, which I reached a dead end, and I was searching for months before I finally found what was able to diagnose, which is the biggest problem in nerve pain, is the diagnosis. Muscle pain and a lot of these other things, they're quite easy to diagnose. Nerve pain is very, very, very tough and almost impossible to diagnose if it's outside the spinal canal without the MRN. So I really hope this helps on a lot of levels, clears some things, and hopefully you'll be like, wow, I have some hope. Because that's what this is all about, and this is what the Sciatic Pain Terminator is all about, is giving you hope that your life is not over, and that there are options out there to help you or a loved one get out of pain. So this is John McMath with the Sciatic Pain Terminator, wishing you and your family a pain-free lifestyle.